Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Abdominal pain and food intolerance can be very stressful in children, especially for parents that are trying to manage the symptoms at home. It's hard to tell if your child is truly a picky eater, is suffering from an actual medical diagnosis, or if they just have an intolerance. For physicians, it's just as hard. Diagnosis is not as straightforward as taking one test. On today's episode, I'm going to run through some of the red flags, the signs and symptoms of food intolerance, picky eating, abdominal pain, and other gastrointestinal issues in the pediatric population. On the next episode of Ask the Doc, No Appointment Needed. Hi, I'm Dr. Scarlet Constant, founder of Constant Care Pediatrics and board-certified pediatrician. Today, I'm here to answer your questions about picky eating, food intolerance, abdominal pain, allergies, and more. It looks like a question is coming in now. This question is from Darcy. Hi, doctor. My 4-year-old niece has been diagnosed with celiac disease. Please tell me what it is and what are some common symptoms. Well, Darcy, to start, celiac disease is an autoimmune disease where your body creates antibodies that actually respond to the gluten product found in foods. With this response, it causes destruction in the lining of the intestine. The antibodies start to separate the border, allowing for swelling and inflammation and other effects. Let's take a look at some of the signs and symptoms of celiac disease. Because of this autoimmune response and the destruction of the intestinal lining, you might find that the patient has diarrhea or even constipation. There will be abdominal distress due to the bloating and the inflammation, nausea, and even vomiting. Celiac disease can also cause mouth sores and ulcers, and that's one of the characteristics is not only do you have gastrointestinal manifestations, but you also have dermatologic manifestations. So you'll have sores in the mouth, ulcers, and even a rash, which we call atopic dermatitis. Some serious cases of celiac disease might present with bone and joint pain. Again, this is due to the migration of the histamines and eosinophils in the joint spaces, causing inflammation, as well as there might be weight loss or weight gain. Sometimes you'll see weight loss in childhood because there is a decreased absorption of calories and vitamins, and so the child fails to gain weight or even absorb the proper nutrients. Finally, you might see headaches, migraines, and even fatigue. These are all the symptoms of celiac disease. So it looks like we have another question coming in. This question's from Lennox. Hey, doctor, we've noticed that our son, Taylor, seems to get bloated and occasionally have diarrhea after eating oatmeal or toast. How do they test for something like celiac or gluten allergy? So Lennox, to answer your question, how do they test for something like celiac or gluten allergy? Well, first of all, gluten allergy is not a recognizable diagnosis. You do not have an allergy to gluten. A person may have an allergy, meaning an IgE-mediated response to wheat, rye, barley, or other products, but not the actual gluten. Secondly, to test for celiac disease, it usually starts with a proper history and physical. There are some screening blood tests that we can do in the office that will actually give us an idea if there is a high risk of having celiac disease. We look for something called IgA, a total IgA, which is immunoglobulin A, and we look for tissue transglutaminase A. So without getting into the whole biochemistry of everything, your doctor can very easily order this blood test as a screening. And I call it a screening because to confirm an actual diagnosis of celiac disease, you ultimately need to get an endoscopy with a biopsy of the small intestine. So rather than sending everybody to get an endoscopy right away, the first thing you want to do is something non-invasive like a blood test. If the blood test is drawn and the the tissue transglutaminase A or IgA are negative, then there's no need to pursue it further. If they are positive, that's when you would want to send the patient to a gastroenterologist for further evaluation. And like I said, the final confirmation of diagnosis is by an endoscopy with a biopsy, where you would actually see typical cells that reflect a celiac disease. If your child does not have celiac disease, and we're concerned about other things, which there are a myriad of other conditions that can cause these symptoms, we actually start to make a food diary, go through the history of the foods that your child is eating. We can even check stool samples sometimes to check how the body's metabolizing sugars. There are many other non-invasive ways to look for other conditions before we get to an endoscopy or colonoscopy. So I strongly encourage you to bring your child to their pediatrician and give them the history so that your pediatrician can decide which tests are indicated and go on further along with the investigation. Okay, it looks like we have another question coming in. This is from Waverly. Dr. Constant, my nephew, Luke, suffers from occasional constipation and is really a picky eater. I'm thinking the two are related. He's 6, and that's too young for irritable bowel syndrome, which runs in our family, right? Well, yes, Waverly, 6 is quite young to diagnose irritable bowel syndrome. And I will tell you that irritable bowel syndrome, also known as IBS, is what we call in medicine a diagnosis of exclusion. And what that means is we need to rule out all of the other diagnoses that may be in the differential for your child's symptoms before we call it IBS. You can't exactly test for IBS. IBS is what's left on the table after all the testing has been complete. So with your child, and I want to see your symptoms again. With your child, it seems like with the diarrhea and the bloating and the intestinal and the picky eating, the constipation, usually that is behavioral. I don't want to just call it behavioral, but we usually see in that age group that picky eating starts to develop for many different reasons. And when they're picky eating, then they tend to develop constipation due to poor choices, maybe a high carb intake, low fiber intake leading to the constipation, or just maybe poor hydration. And then it's a cyclic effect. Their tummy hurts, they don't have normal bowel movements, and therefore they don't eat as well. So it becomes a vicious cycle. There are also many other reasons for constipation. Again, I think it's important that your child sees their pediatrician so that you can go through the history with your pediatrician and kind of ascertain whether or not your child is constipated due to dietary influences, or if there's actually a structural abnormality causing the constipation. So these are very important to rule out before we call it picky eating or before we call it IBS, irritable bowel syndrome. Okay, it looks like many parents have many questions about abdominal pain and picky eating and dietary changes. So here's another question coming in from Robin. Dr. Constant, our first child, Lucy, never had any gluten issues, but child number 2, Lars, does have some intestinal issues such as constipation, urgent bowel movements, and weight loss. What could be the cause of these symptoms? Well, Robin, that's a great question. Constipation is very common in this age. 2 years of age is a time where we're learning how to potty train. We're teaching them how to hold and then go to the toilet. And it's a very difficult time because communication is just beginning. And we oftentimes see that toddlers will withhold their stool. And when they withhold, that they develop constipation. Now, if we're discussing constipation along with urgent bowel symptoms, yes, sometimes children become impacted and there's a high fecal load, which causes urgency to use the bathroom. But if you couple that with weight loss, that's where I'm a bit more concerned. At the age of 2, with an adequate diet, there is no reason why a child should actually be losing weight unintentionally. And with that, I would certainly bring your child into the pediatrician to evaluate and to do testing as needed. I personally think that stool testing would be in order to see why there are times where your child has urgency rather than constipation. If sometimes there could be like a malabsorption, which they're not absorbing vitamins correctly. Maybe there is a change in the lining of the intestine. There are many different different things that we can look for that were not diagnosed maybe during the prenatal period or initially when your child was born that could possibly be diagnosed now in the toddler years. So it is important to bring all of these symptoms to your pediatrician and make sure they are working up your child for some type of gastrointestinal disorder or gastrointestinal lining defect that might be causing this issue. But like I mentioned before, it is really important to note that a toddler should not lose weight unintentionally or gain too much weight unintentionally. That is always a red flag. Another thing that we like to look at is the growth, the height or length of your child. If the growth is stagnant, that's also a reflection of poor nutrition, which can be linked back to a gastrointestinal issue. So please take those symptoms seriously and have a talk with your pediatrician. Okay, so we have a question coming in from YouTube. This is from Katarina. Doctor, my stepson Danny is a good kid, but he's wound a little tight and always seems anxious. He frequently has tummy aches and suffers from constipation. We've had him tested for IBS and celiac disease, but the tests were negative. Could it be the result of stress and anxiety? Well, abdominal pain has a very strong correlation to anxiety and stress. Absolutely. The two are intertwined. It is very important to talk to him about his anxiety levels, really investigate his stress levels, and see if he has a way of coping with this anxiety. Sometimes children don't have a way to cope, and they might not even know how anxious they are. And rather than feeling stressed out, which is what we believe they would feel, we ask, are you stressed? Are you unhappy? Are you sad? And they really can't answer. The only way it would really manifest sometimes is just abdominal pain. It's truly a symptom of what's going on in the brain. The brain and the stomach are related. They are intertwined and they feed off of each other. Headaches sometimes will manifest with abdominal pain, stress with abdominal pain, and sometimes abdominal pain will feed back the loop and give a headache. So these two are very related, and it is important to address the anxiety and stress that your son is experiencing in an effort to control the abdominal pain. Of course, it's important to rule out any organic cause of abdominal pain. We're looking for constipation, any type of food intolerance, or even a food allergy. There might be a food allergy that you're not even aware of. And just because your son's not having a frank anaphylactic reaction, it's something that goes under the radar. So we certainly want to look into food allergies, IgE mediated allergies. And if those things are ruled out, we can start talking about the mental effects that your son is having with his gastrointestinal issues. There are some children that actually are treated with anti-anxiolytics and antidepressants for their abdominal pain. So very astute of you to notice and to realize and to take that into consideration. And I certainly think it's worth bringing up to the pediatrician. Hi, so here's a question coming in now from our All Health TV app. This is from Eileen. Dr. Constant, both my wife and I have tested positive for celiac disease. Even though neither of us has experienced noticeable symptoms, we've been wondering, if we have children, are they at higher risk for developing the condition? Yes, Eileen, they're certainly at higher risk, being that this is a genetic disease, and being that the both of you have it, there's absolutely a higher risk for your offspring to develop the disease. It's great that you don't have symptoms or noticeable symptoms, which is wonderful, but I still encourage you to adopt a gluten-free diet. This is important because while you're not feeling the symptoms yet, it doesn't mean that the gluten is not already causing damage to the intestinal lining. And so by the time you do start to feel symptoms or effects, at this point, the lining has already been far damaged. So it's great that you caught this early, and I highly encourage you to eliminate gluten from your diet completely. And also eliminating gluten from your diet will help your future child. If you're in a home where there's no gluten exposure, they will be at less risk of developing the disease later on in life. So my advice would be to adopt a gluten-free diet and then, of course, look out for the signs and symptoms for yourself and your child in the future. Okay, so we have another question coming in now from YouTube, and this is from Angus. Hello, doctor. What is cross-contamination in celiac disease? Well, Angus, cross-contamination basically means that the actual product that you were trying to isolate from your meal has somehow made its way through and contaminated your meal. So sometimes there are gluten-free products that might have had a little bit of gluten come into contact and contaminate it. So while you believe you're eating a gluten-free product, you might start to have the symptoms because there is gluten present and it is taking an effect. So please be very careful read all labels, and if cooking at home or if you're out at a restaurant, make it clear that you do have celiac disease and you need to make certain that there is no cross-contamination of the products. Okay, another question is coming in. Let's take a look. Tracy, hi doctor. What, if any, new therapies or treatments are there for folks suffering from celiac disease? Well, so celiac disease is very interesting in that there isn't an actual process that's occurring that you need to treat or stop. It's literally having a reaction to the introduction of something. So if you just don't eat gluten, you don't introduce gluten into the body, into the GI system, then you won't have the reaction and you will be fine. And once you adopt a full gluten-free diet and eat appropriately and get the right vitamins and nutrients, you could live a very happy, symptom-free life, thriving, growing, gaining weight, gaining height, and being well nourished. So a gluten-free diet is definitely the way to go. And unlike allergies, desensitization is not a form of therapy because, again, unlike allergies, gluten intolerance is not an allergy. It's actually an autoimmune response. Okay, looks like we have another question. This is from Pippa. Dr. Constant, our daughter Ellie was just diagnosed with celiac disease. What can we do to help her advocate for herself when she's at school and out in public? And speaking of schools, how can we get them involved? Well, Pippa, that's a great question. You know, the answer varies across schools. Unfortunately, cities, counties, and states, everybody approaches this in a different way. I will say that a lot of public schools actually have forms that you fill out before you enroll your child into school, and these forms indicate intolerance and allergies that are present. And what this does is they keep this form on file for your child so that your child is able to find foods that are safe for him and her. And you can your physician fills out this form and you actually even indicate what some alternatives are for your child to eat so that they have them present in the school. At least where we are in our county, all of the public schools do this, which is really great for your child because it's on file. Any nurse or any teacher can look back at it and see that this is legitimate and confirmed and signed by a pediatrician, and they are supposed to have options for your child. The other option, of course, is sending your child to school with their own lunch. This way you ensure that they're safe and they know what they're eating, and we don't have to worry about cross-contamination, which can happen innocently. So I think sending your child to school with their own lunch is really a great idea if that's an option for you. If not, like I said, you'd want to fill out the forms to have them on file at school that your child has an allergy or an intolerance. Finally, I've seen a lot of schools, smaller schools, charter schools, or even private schools have many gluten-free options for the kids. So it's up to your child to make the right choice and go get the right food. How can we get the schools involved? You know, that's very difficult because, you know, schools purchase their food from food vendors. So the real question is, how do we get food vendors to offer foods that are appropriate for our children and that are gluten-free? That is something where, you know, I hate to sound like a broken record, but that's when you and your community need to be active and get out and vote. So it looks like there are still some questions about this. There are many parents that have a lot of questions about abdominal pain and celiac disease and food intolerance. Luther wants to know, hi, Dr. Constant. I'm curious about something. Is there a difference between food allergies and celiac disease? They kind of sound similar. Yes. So food allergies. This is when you have an actual allergy to a specific food. The food is the allergen. So you can have an allergy to wheat. You can have an allergy to milk. You can have an allergy to lobster or crab, a specific food. And what that means is your body develops IgE immunoglobulin E. It develops an IgA response that reacts when these foods are introduced. And that causes all your histamines, it causes swelling and hives, and as we've seen, vomiting and nausea and lip swelling and eye swelling. This is an allergic reaction. This is an IgE-mediated reaction, which involves histamine, which is important to remember. Because celiac disease is not IgE mediated. It is an autoimmune response. Your body creates an antibody that reacts to gluten. Gluten is a product found in wheat, barley, or rye. So you're not actually allergic to the wheat. You're not allergic to the barley. Your body is reacting to the gluten that has been introduced in these products. And then this causes actually destruction at the level of the intestine. So you don't have an IgE-mediated response where you have swelling and hives and swelling of the tongue and vomiting. Instead, you have a destruction of the intestinal lining that happens very slowly, causing abdominal pain, causing bloating, and causing diarrhea. And remember, celiac disease, people forget to mention or forget to realize that celiac disease does have a dermatologic component. Those with true celiac disease have atopic dermatitis or eczema, and it is severe. And this is found with the actual gluten intolerance. So I hope that this wasn't too scientific for you, but I just wanted to really clear up the misconception that gluten or celiac disease is a gluten allergy, because it is not. And you can have a food allergy and not have celiac disease. You can have celiac disease and not be allergic to anything whatsoever. Okay, it looks like we have one more question coming in. This is from Barbara. How can we help our young children, ages 9 to 12, function as normal kids when they can't eat pizza or get stomach aches from bread and other gluten products? Well, I think that 9 through 12-year-olds can absolutely function as normal kids if they can't eat pizza. I think that we need to learn as a population that we can diversify our diet. We don't have to have a diet that revolves around carbs morning, afternoon, and night. There are many other cultures where carbs are not such a staple in their diet, and it's perfectly fine. And the children lead normal lives and are happy and thriving and don't feel left out. There are many other options, and I think that it's time that we start really focusing on those options. This should be a turning point for most of us where we realize, you know what, maybe we are taking in too many carbs. Maybe we are eating way too much fast food. Maybe we're taking too many shortcuts feeding our kids. We get lazy and tired, so we make pasta and mac and cheese and sandwiches endlessly. We have to look at ourselves and look at what we're doing and think maybe we need to change our habits so that our children can change theirs. And don't get me wrong, gluten-free doesn't mean you can't have pizza. There are so many options. As a matter of fact, Papa John's has the best cauliflower pizza there is. There are so many vendors that have changed their ways and that have adapted to this change in our community. And so there are options, and you just have to look out for them and be aware. So I hope that that was helpful advice to you. I think that we have another question that just came in. Let's take a look. Zach, my 18-month-old daughter has tummy aches quite often, and my wife and I don't know what to do for them. She eats vegetables and fruits and meat, but she still has stomach aches on a regular basis. We just brought home a new little brother. Could that be part of the problem? You know, Zach, she's 18 months old. It's really difficult to tell. I'm glad that she has a great diet, and we'll watch that. Let's look at her stooling pattern. Let's see how she's doing with her bowel movements. Make sure she's not constipated. Always speak to her pediatrician about it. Make sure it isn't something organic going on in the belly. And then perhaps maybe it is a little bit of stress. Time will tell. Thanks for watching, everybody. Have a great day.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.